Hi, I'm Dr. John Flucke, Technology Editor for Dental Products Report magazine, and today I want to talk to you about a new device that has really caught my eye and is really beginning to catch the eye of the dental industry, and that is the Kerr Demi Ultra curing light. This thing just came on the market. It's an amazing device. Let me tell you just a little bit about it. The neatest thing about this particular device is that for years and years and years in dentistry, as we moved into LED curing lights at the beginning of this century, was always about the battery. And the batteries go dead, batteries wear out, and that became a big problem with these devices. Kerr has really beat that with the idea of something completely different to provide power to this. This device is cordless, but rather than using a standard battery that recharges, you'll notice the name is the Demi Ultra. This device uses something called an ultracapacitor, and that ultracapacitor is a device that holds an electric charge, but it does it in a completely different way than a battery, which is, on a normal situation, you would take the device, you put it in your charger, and you wait several hours for it to take a full charge, like anything does nowadays that runs on batteries. Your cell phone charges in several hours, your iPad charges in several hours, your curing light charges in several hours. The ultracapacitor completely blows that out of the water. The ultracapacitor goes to full charge on this device in under 40 seconds. When the device is completely discharged, what you'll get is a red light that indicates that you don't have any power. So if I hit the power button here, nothing, okay? Placing it on the charger, you can see that you get a yellow LED, and that yellow LED indicates that it is now on the charger and it's charging. And what we're going to show you here as we go through this is just how rapidly this device actually does charge. In, as we said before, 40 seconds is about all it's really going to take before that device is ready to go. You could, if you needed to, actually pick it up right now, and you would have some curing. So if you were just maybe one restoration short or one curing cycle short, even that minimal amount of time would be enough to allow you to then go back to the mouth. But if you'll notice, now we're green, and now the device is completely charged. One of the other things that's really great about the ultracapacitor system in this is the ultracapacitor has a lifespan of 10 years. And you think about that. It will continue to hold an adequate charge to do your 25 10-second cures from the day you buy it until 10 years after that. So this device, with the charging ability, is well going to surpass the technology, and something better will come along way before you ever have to worry about the fact that, well, there's no replaceable charging system in it. It doesn't need one. There will be a plethora of new technologies that have come along that will allow you to simply say, we're done with this device, let's move on to the next. This is new to a dental curing light, but the whole concept of the ultracapacitor and the development of the ultracapacitor is not a new technology at all. The ultracapacitor has been around for 50 years. If you're driving a hybrid car, you have an ultracapacitor in there somewhere. There are ultracapacitors in digital cameras, lots of other situations. So it's not like this is something that they just put together on the bench 6 weeks ago, and suddenly now you've got it in your hands, and is this going to work or is it not? The ultracapacitor is an amazingly proven technology over the long haul, and what's really cool about this is that Kerr has managed to take this and get it into the footprint that allows you to put it into a curing light so that it's small, light, portable, easy to use, and yet still provides you all the benefits of that dropping it in the cradle and getting a full charge in less than 40 seconds. And by that I mean the ultracapacitor then gives you the ability to do 25 10-second cures with a 40-second charge, and that is a complete and utter full charge. Now what's neat about that is a lot of people will say, well, 25 10-second charges, it doesn't seem like a lot. In my office, as we've gone through this and used this in a testing phase, I'm finding that easily 95%, maybe higher than 95% of the cases don't use 25 10-second charge cycles. So in other words, what I mean by that is the majority of the cases that I'm doing, over 95%, are done with this, and I never even have to put it back on the charger for that particular procedure. What I love about this then is when we're done with the procedure, my assistant turns, puts this on the charger, and in 40 seconds, this thing is completely, fully charged and ready to go again. Even worst case scenario, if you're in the middle of a procedure and you exceed that limitation and suddenly you realize, oh wait, we've got to charge it, 40 seconds to full charge. So the days of losing productivity or the panic that sets in because your device isn't charged is over. Simply put it on the charger, and just a little bit longer than half a minute, you are completely good to go.